Good day, and thanks for giving me this opportunity to share this presentation with you. My name is Denny Mabetha. I hold a Masters of Science in Field Epidemiology from the Wits University. The title of my presentation is Voice Needs Tip to Have a Bite, Strengthening Social Accountability in Health System Through Participatory Learning and Action. This is the part one of my presentation. I'll speak about the theories and method participatory approaches to strategically advance collective agency and accountability in health systems. The overview includes community participation and social accountability concept, how we apply the research in developing social accountability in health system in rural South Africa, and embedding in health system the broader social and political context. Community participation in social accountability speaks about recognizing and enabling those at the heart of the issue to address it and learn from the process. Contested concept which are range of interpretations and focus on empowering the users. The fuller form seeks to shift power towards those affected to know, understand, act, and transform. And it based on the functioning of health system, the central system and institutional change towards social justice, and transcends boundaries between the researched and the researchers. This is the letter that is explained by the Einstein. Speaking beyond the letter towards the situated practice is about a reduction to think about good or bad forms of participation instead of considering complex dynamic processes and situated practice, which are in particular social and political environments that enable or constrain. Speaking about social accountability, it's about improving of services, strengthening of governance, and empowering of the citizen. The tactical one assumes that the voice is sufficient, information alone will save the day, while the strategic one is about strengthening citizen action in parallel with supporting state capacity to respond. I will take you through how we apply the participatory method in applying participatory learning and action in rural South Africa through the 3 learning action cycles. The work was conducted in Mpumalanga province, the northeast of South Africa, under the Agent Code HDSS surveillance unit. The HDSS consists of approximately 120 population in 31 villages. 30% of the population are former Mozambican refugees, and the fully serviced household to isolated rural homesteads. There's little or informal sanitation. Electricity is available but not affordable. There's high unemployment rates, and 84% of the population is below the poverty line. As I mentioned, that this process is a 3 learning cycle, which consists of the observe, analyze, and action state. I will give a brief overview of each stage of the process. So in step 1, which is the engage and observe stage, we build community of voice, developing develop dialogue with authorities. This was to give a detailed account of local public health priorities using narratives, visuals, some of the participatory action research method, and statistical data, the verbal autopsy. And step 2 is the analyze or plan step, which initiated multi-sectoral dialogue between the service users and the service providers. We generated a shared understanding and developed and committed to local action plans, and demonstrated a detailed reference to policy and implementation context. These are the pictures on the left that show how the process was conducted. This is a picture that shows researchers, service users, and service providers working together to act on the evidence. As I mentioned, that some of the approaches we use as the participatory action method, we use the photo voice, which is the process where community stakeholders were trained to use camera to capture lived experiences of their situation. In this case, it was the priority topics that were nominated: alcohol and drug, and lack of safe clean water. As you can see, the pictures on the left talk about how lack of safe clean water affects the communities, and on the other one is the impact or the effect of the alcohol and drug abuse. We also have slides that talks to the statistical evidence. This shows how the proportions of mortalities attributable to alcohol and drug abuse in Agincourt, and the other one speaks to mortalities attributed to the lack of safe clean water. Step 3 of the process was to reflect on the process. So the communities and the service providers collaborated or engaged to reflect on the evidence and act together to bring change. They developed a joint action plan that were implemented and evaluated to ensure that accurate data was conducted together with the communities and the service providers. We developed a monitoring tool to capture the number of the visits and activities that were occurring throughout the process. We had 96 follow-up visits, and during those visits we established relationships with our service providers, mainly the Department of Health, aligning them to the priorities that were nominated: alcohol and drug abuse and the lack of safe clean water. We embedded the process into the routine primary health care planning and review. On the right, there is a summary of some of the actions that were planned and monitored. I'll just give an example with to give a summary of some of the actions. We have the actions shaded in green, which are actions that were collectively achieved. The ones in yellow, there was some progress, and the red one, there was no progress at all. The aim of this process was to demonstrate or to capture what has worked and what has not worked and what can be improved. As you can see, the action to identify hotspots of alcohol and drugs in the communities was achieved as an action, while there was some progress with regard to action number 4, which was to disseminate information on alcohol and other drug abuse activities in the rural communities. Now that we have developed, collected the data, reflected and acted on the evidence, we then proceeded to embed in health system within a broader social and political context. As we know that, just to give a background, South Africa is an upper middle income country with an estimated population of 59 million, a third of which is rural. The life expectancy is sitting at 64 years was sitting at 64 years in 2017. Post-apartheid health sector transformation, there's still inequitable curative hospital-based system to community-based primary health care, which are equitable to provision and prevention at the primary health care setting. The health policy context progressive and inclusive public health system still faces multiple competing challenges. Despite the large economy on the continent, South Africa remains one of the most unequal countries in the world. Just before I complete my presentation, I want us to focus on the macro level shifts. Is it mandating co-production? Decentralization on national commitment brought primary health care revival. In 2012, the National Health Insurance Support for UHC. In 2021, primary healthcare re-engineering of provincial guidelines, and then in 2027, the ward-based primary healthcare outreach teams were introduced. The organizational compliance cultures, governance processes is often deeply politicized. Community-based programs similarly have limited capacity, autonomy, authority for planning and management. The frontline providers are voicing strong preferences for local disaggregated data and experiential knowledge to inform local appropriate and responsive decision. We've noticed during the COVID-19 that there was a decentralized data-driven community and preventative approaches to address the COVID-19. In conclusion, what I want to highlight is that community stakeholders can identify or have a potential to identify issues with broad relevance. Government stakeholders can support state capacity to respond to community voice. Cooperative action learning can create safer spaces to engage diverse and otherwise disconnected stakeholders. Therefore, there's a need to nurture relationships and mutual understanding, especially of implementation context, to build communities of action learning. Thank you so much. I would just like to acknowledge the following stakeholders or partners who have contributed to this work. Thanks so much for your time.